Hi, I'm Dr. Abhishek Mangeshikar, an endometriosis specialist and excision surgeon. One of the most difficult and heartbreaking issues I see in my practice is when patients with endometriosis struggle with recurrent miscarriage or repeated pregnancy loss. Naturally, many women ask, could my endometriosis be causing this? Is there a link between endometriosis and miscarriage? In this video, we'll explore what recurrent miscarriage is, how endometriosis may contribute to miscarriage risk, the possible mechanisms involved, what we know from current research, how a specialist approach can help reduce risks, and what steps you can take if you've experienced pregnancy loss and have endometriosis. Let's begin. Recurrent miscarriage is typically defined as 2 or more consecutive pregnancy losses, usually in the first trimester before 12 weeks, though it can also include second trimester losses. It is a devastating experience both physically and emotionally. There are many potential causes, including chromosomal abnormalities, uterine abnormalities, immune dysfunction, blood clotting disorders, hormonal issues like thyroid disease or PCOS, and increasingly, we are recognizing that endometriosis may also play a role. Let's talk about why endometriosis could influence miscarriage risk. Endometriosis is not just a local disease of the pelvis. It is a systemic inflammatory condition. It can affect the uterine lining or the endometrium. Inflammation in the uterus may impair the implantation of the embryo. Altered receptivity of the endometrium, which is the uterine lining, may not be optimal for supporting a pregnancy. Hormonal environment. Endometriosis can cause progesterone resistance, meaning the uterus does not respond properly to progesterone, a hormone critical for maintaining pregnancy. Immune dysregulation. Women with endometriosis often have altered immune responses, which may lead to embryo rejection or impaired placental development. Anatomical factors. Adhesions and scarring can distort the uterus or fallopian tubes, impairing fertilization or embryo transport. Now, what does the current scientific evidence say about the link? Several studies and meta-analyses have shown that women with endometriosis do have a higher risk of miscarriage, particularly those with deep infiltrating disease, ovarian endometriomas, and advanced stage disease. Even in women who conceive naturally or with IVF, miscarriage rates are often higher in those with endometriosis compared to women without. One large meta-analysis found that women with endometriosis have approximately a 1.5 to 2-fold increased risk of miscarriage. However, this is not universal, and many women with endometriosis still go on to have healthy pregnancies. The key is to approach fertility and pregnancy in endometriosis with careful specialist evaluation, a personalized plan. Here's what we typically do. Optimize the pelvic environment. Excision surgery in cases of deep disease, severe adhesions, or ovarian endometriomas can reduce inflammation, improve uterine receptivity, restore normal pelvic anatomy, improve natural conception rates and outcomes after IVF. Address immune and hormonal factors. For women with immune dysfunction, reproductive immunology input may be considered. Progesterone support during early pregnancy is often used. Coordinate with fertility specialists. In cases of recurrent miscarriage with endometriosis, we work closely with fertility specialists to optimize ovulation, uterine lining, embryo quality, immune modulation where appropriate. Monitor pregnancy closely. Once a pregnancy is achieved, we ensure close monitoring, especially in women with previous losses. Not every woman with endometriosis will have miscarriage risk. Many will have completely normal pregnancies. The risk is higher in women with deep, extensive, or untreated disease, particularly if the uterus or ovaries are involved. Proper surgical excision can improve pregnancy outcomes, both natural and assisted. Every case is different, and a specialist-led, individualized approach is crucial. There is hope. If you are watching this and have experienced pregnancy loss, first let me say, I understand how painful this is and you are not alone. If you have endometriosis and are concerned about your fertility or pregnancy outcomes, please know that there is growing awareness on this link. There are ways we can reduce risks and optimize your care. You do not need to navigate this alone. Seek out an experienced endometriosis and fertility team. And most importantly, with the right approach, many women with endometriosis go on to have healthy pregnancies and healthy babies. Thank you for watching. I hope this video has helped explain the link between endometriosis and recurrent miscarriage and what steps we can take to improve outcomes. If you've experienced this, or if you have questions about fertility preservation, excision surgery, or pregnancy planning with endometriosis, please feel free to leave a comment. And if this video was helpful, please like, share, and subscribe for more expert content on endometriosis, excision surgery, fertility, and pelvic health. Take care, and I'll see you in the next video.